Hello, everyone. Happy Tuesday, February 2nd, and welcome to the latest edition of the Cosmetic Laser Dermatology webinar series. I'm very excited. Today we're here with Dr. Boen. Hi, Dr. Boen.
Hi, everyone.
If it's been a while since you've seen her, it's because she's been a little bit busy making a baby. Thus, our topic today is very relevant. So today, Dr. Boen is going to be speaking about postpartum skincare and rejuvenation. Having a baby is one of the most wonderful life experiences, but it can also do a number on your skin and body. So Dr. Bowen's going to go over and teach us a little bit about all the aesthetic treatments that are great while you're trying to conceive, while you're breastfeeding, or after you have a baby. I'll just give a few more minutes for everyone to join. In the meantime, after her short presentation, we'll have some time for Q&A. So you can use the Q&A feature on Zoom. And Dr. Boen is also available. When are you available for consultations again?
I'll be back February 17th.
Okay, it's coming up, I guess, 2 more weeks.
2 more weeks.
So you can book and schedule a virtual consultation or an in-person to discuss with Dr. Boen any of your postpartum skincare concerns. Just a little bit about Dr. Boen. She's a board-certified dermatologist. We are very happy to have her, and we're very happy that she's back. But Dr. Boen is an expert at all things cosmetic dermatology and also does a lot of medical dermatology at our sister practice next door, which is West Dermatology. That was a lot of dermatologies in one sentence. Anyways, she's going to be going over a number of injectable and laser and other non-surgical treatments today. Any of the board-certified dermatologists in our practice can do these procedures, but Dr. Boen is perfect to speak about this topic because she just had a baby herself. So without further ado, let's get right into it. So Dr. Boen, thank you so much for being here. Take it away.
Hi, and thank you so much for joining my webinar on postpartum skincare and rejuvenation. So let's start a little bit about my postpartum journey. So, pregnancy began, it wasn't too bad. And I took these maternity photo shoots at 31 weeks. I was feeling pretty good. I had the pregnancy glow, the hair was flowing, I think I looked pretty good. And then like postpartum hit. And so the hair is a little bit more disheveled, thank God I'm wearing a mask. So you can hide a little of the blemishes, the dark spots. And it's a little challenging the postpartum period with your skin and body. But it's all worth it because I have this cute little one named Cora, and she just lights up my day. So let's talk about pregnancy and postpartum skin and body changes. So I don't know if you guys can relate, but the first few weeks of having a baby is kind of like this photo here. It is, it's a little bit of a struggle, the hair's disheveled, you're trying to get food and coffee down, but it's also, it's a wonderful time. So some of the changes that we undergo are there's some skin swelling. Your skin is pretty dry as well, especially postpartum if you're breastfeeding. You have stretch marks. Some patients don't, but about 80–90% of women will get stretch marks in pregnancy. You have new vessels forming, either leg veins or cherry angiomas. We'll go over that later. You have abdominal skin laxity, and there's the weight gain. But even though we're talking about all of these body changes, I just want to emphasize body positivity and that our bodies are producing this amazing baby, and it is definitely all worth it, even if we have some battle scars. In this lecture, just to give you some options if you want to treat yourself or do little tweakments to help yourself out postpartum. So I'll be talking about my top 10 postpartum skin solutions, but before we go into that, we'll do a little poll. And we'll get Risa back on, and we have a few questions before we talk about some of these solutions.
Perfect. So here we go. All right. So first, just before we get into that, why are you interested in postpartum skincare? Tell us about you. Are you currently pregnant, breastfeeding, trying to conceive? you have a baby or toddler at home. All right. Here we go. So only a few people gave their answers, but it seems like most of you have a baby or toddler at home, so you're in the same camp as Dr. Boen or even me personally. But some of you are, one of you is currently pregnant and one currently breastfeeding, so I guess you have a little bit of everything, Dr. Boen. All right, let's go on.
Okay, so I came up with this top 10 list of skin solutions, but you know, they were kind of negative. I was talking about hair loss, stretch marks, weight gain, dark spots, and I wanted to make this a little bit more positive because, you know, your postpartum body made this beautiful baby, and it's okay if we have a few little problems or things going on. And I wanted this to be a very positive lecture. So instead, I changed it up and made it into more positive things, like how to get radiant skin, even pigment. And we kind of will take this more positive approach. Once again, these are skin solutions. And some of these options are breastfeeding friendly upon discussion as well. And I'm currently breastfeeding, so definitely aware of those concerns with patients. And a lot of these are tailored for low downtime because as a mom, you don't have a lot of time to sit and wait for high downtime procedures. So let's talk about radiant skin. So I boiled this down to my top 3 lasers for radiant skin. And what do we mean by radiant skin? This is an example a patient actually sent me. We treated an area under her mask. And as you can see, the treated side is a little bit smoother. The pores are visible. And this is because these lasers produce new collagen and they help the overall aesthetics of the skin and give you that glow. So one of these is the Clear and Brilliant laser. And this is an example here. Your skin will be a little bit red like this for a day after the treatment. The next day, you can put makeup on, very little downtime. And there's one setting that helps get rid of pigmentation. Another helps rejuvenate and increase collagen production. So a very popular treatment option. The next one is the Intense Pulse Light, which treats reds and browns and also can decrease pore size. Also a fantastic treatment, very quick and very low downtime. The last one is radio frequency microneedling, which uses this intracell device. And there's teeny little needles that go into the skin to also increase collagen production. This one has a little bit more downtime, about 2 to 4 days due to crusting. But nonetheless, you do it on Friday, you can go back to work on Monday. And usually you need about 2 to 3 treatments, depending on which laser you pick. And you can definitely interchange them depending on your skin type. And I usually will let you know your options based on skin type and downtime in the consultation. So next is smooth skin. So for this, I probably recommend Botox. It's been tried and true, and there are 4 different types of neuromodulators out there. It's not indicated for breastfeeding, unfortunately. But other than that, after you're done, get some neuromodulator treatment. So there's 4 on the market. They have different properties, but they're all the same toxin. They differ by their manufacturer and also when it kicks in. So Dysport and Jewel will kick in the fastest, and then Botox and Xeomin will kick in a little bit slower. So if you have something to do this weekend, you need a quicker treatment, I recommend Dysport. If some people think that, feel that the Botox, the brand works better, no problem. Whichever one you pick, I'm happy to work with you. And this one, we had treated her frown lines. And here we treated the forehead. So you can still have some movement, but a lot of the lines are erased with neuromodulator treatment. And the next one is even pigment. So in pregnancy, your skin is more sensitive to the sun. So you'll notice maybe a little bit more dark spots, some freckles on the cheeks. And there's another thing called melasma, which we'll address in a second. And so in this case, we did Intense Pulse Light and the picosecond laser, or pico toning, to help get rid of these dark spots and make the skin a little bit more even in pigmentation. And once again, the three I recommend are the Clear and Brilliant Laser, the Intense Pulse Light, or the picosecond laser. And the downtime is between a day to 5 days, depending on how aggressive we do the treatment and which laser we use. The next pigmentation issue that's really common in pregnancy is melasma. And it's tough too because you can't use certain products in pregnancy and postpartum with melasma if you're breastfeeding. However, there's still options and we'll work with you. And so melasma is very common throughout pregnancy. So number one is sunscreen, topical skincare therapy. The next one, probably the Clear and Brilliant Laser or the picosecond laser. And as you can see, in this result, in this instance, I did the picosecond laser and the Clear and Brilliant laser. And so after 2 treatments, along with topical therapy, as you can see, it's cleared out very well. So next, redness. So one of the things that happened to me is I had an acne flare-up during pregnancy and postpartum. And I also developed these cherry angiomas, which are really common to occur anywhere in the body, but definitely like chest and breast area. So this is an instance where I use the V-beam and topical therapy to help treat acne. The V-beam helps target redness and will dissipate the redness much quicker. Next are cherry angiomas, which are little circular red spots, which is a collection of vessels. This is actually my cherry angioma, which I V-beamed once. And this is my hand. I took a picture of this yesterday. So it's a good and effective treatment, usually 1 to 2 treatments, and you'll be able to get rid of that cherry angioma. And then leg veins is another thing after pregnancy. I actually wore compression stockings throughout my pregnancy and was happy not to get any leg veins. But if you do, sclerotherapy is a good option for the leg veins. Okay, hair growth. So telogen effluvium, what is this? This is one of the most common causes of hair loss postpartum. And I don't know if you know when the most common time to get telogen effluvium is after pregnancy. It is 3 to 6 months. You'll start losing hair, thinning out hair, and it is a natural process, either from the stress of delivery or hormonal changes. The other one that can sometimes happen is female pattern hair loss or female pattern alopecia. Either way, I usually recommend these treatments for this. First, you have to start off with a balanced and high protein diet so that the hair has a chance of, the best chance of growing. There are these supplements made by, they're called Nutrafol, that have helped as well. They contain plant botanicals and other ingredients to help spur hair growth. The other is topical minoxidil or Rogaine, which is a tried and true standard for hair loss. And then another procedure that we offer is platelet-rich plasma, which is in the picture over here, where we take a sample of your blood. We use a special mechanism to spin it and withdraw the platelet-rich portion and inject it into the scalp. Usually 3 to 4 treatments, and then you'll start to notice a difference. However, I usually recommend a combination therapy with all of these in order for you to get the best results. So next, the stretch marks. So I think the number one question I get from all pregnant or patients trying to, who are thinking of getting pregnant is stretch marks. How do I prevent stretch marks? So unfortunately, there is not a lot of data on how to prevent stretch marks. You can do just basic things such as good moisturizers that are fragrance-free. However, from the data and trials, there's nothing that has been clinically proven to work. So it might be genetics, and sometimes it's out of your control. So some treatment options that to start with are topical therapies, hyaluronic acid or retinol or retinoid on the stretch marks. And then I usually do the V-beam laser pictured here, plus or minus a Fraxel laser. And I like to treat these stretch marks when they're red, which are the fresh ones. When they turn white, it's a little bit harder to treat them, but it's still possible. And with these laser treatments and topical therapy, it's hard to get the stretch marks completely gone. However, they can become much less noticeable, and patients are happy afterwards for like it is about a 25 to 30% reduction, but still it does help shrink them down and become less noticeable for patients. So skin tightening. So after pregnancy, the biggest concern is also abdominal skin laxity and saggy skin in the abdomen. And also sometimes you get a little bit of facial skin drooping too from like the swelling of pregnancy. And then after that subsides, you get a little bit of skin laxity. So there are two very low downtime procedures that will help with these concerns. I will say they're not a miracle. They do help tighten, but they're not like a surgical procedure. But they are minimal or no downtime. And this is an example of the Thermage procedure that uses radio frequency to deliver heat to stimulate collagen. And the goal is to stimulate collagen in order to help support that skin. And the other is Ulthera, which is the microfocus ultrasound that also goes to specific depth in the skin to stimulate collagen production. And very minimal downtime. This is done in clinic. Usually this procedure is about an hour. Next, body contouring. So we do cool sculpting and liposculpture at our clinic, but if you want something with low downtime, cool sculpting is the tried and true method. It uses heat extraction to freeze the fat selectively, and then the fat cells kind of shrink up and die, and then your body takes them away. You can use it in the abdomen, thighs, neck, and arms. You have different applicators, and we have the newest cool sculpting elite out there, which will be in a different webinar, and that is a cool system that we're using in our clinic now. The cool sculpting treatments usually need 1 to 2, spaced 2 to 3 months apart, and expect a 20% reduction in fat. So it's not a miracle as well. However, a 20% reduction in fat with minimal downtime is usually delivers a satisfactory result for patients. And here we are. This is pre-COVID, and when I was much skinnier. So this is a picture then. This is an example of a patient had 4 cups on the lower and upper abdomen, and this was after 2 months is when you see the best results. And so kind of gets rid of that little fat layer, which would be very helpful postpartum, and I'm definitely considering it. So next, muscle, whoa, okay, this is the only photo I had. It's definitely not the best, but this is me getting a cool tone treatment before I was pregnant. So cool tone is one of the newest devices we have. It's magnetic muscle stimulation. And basically, it's using electromagnetic energy to stimulate muscle contractions. So it's like you did 1,000 sit-ups if you're doing your abdomen. And afterwards, you feel pretty sore, like as if you've done a workout. You can do cool tone to strengthen the muscles of the abdomen, buttocks, and thighs. Usually it's 4 treatments within 2 weeks. After the treatment, you're pretty sore, but no downtime. And that's kind of the beauty of it. Each treatment is about 30 minutes. And then lastly, vulvovaginal rejuvenation with Thermiva. So this is one that's not really talked about that much, but has a really high patient satisfaction. And this uses radio frequency therapy to, it's like using this little probe here, goes into the vagina, and it delivers radio frequency energy that then turns into heat to stimulate collagen production. And it's good for vaginal laxity. It can be in the vaginal area and in the labia majora minora, so outside, for skin laxity. And it also helps with stress urinary incontinence, which is really common after pregnancy. It's 3 treatments spaced 4 weeks apart. Little or no downtime, just need a normal pap smear beforehand. And this is, it's about 30 minutes per treatment and a very high patient satisfaction. Once again, I definitely want people to know about it because it is not spoken of a lot, but very, very happy patients after it. So this is my rundown of the top 10 skin solutions postpartum. Once again, I want to emphasize these are solutions. I want this to be a positive lecture. I know all these things go on after pregnancy, and if you want to do little tweakments, little more even pigmentation, then we've got the lasers for you to do it with minimal downtime.
Great. Thank you so much, Dr. Boen. That was a great overview of the treatments that are available for people thinking about getting pregnant or postpartum. If anyone has a question right now, you can put it in the Q&A feature or in the chat, and then we can ask Dr. Boen. For now, I have a couple here, so let's get started. So what is best for acne postpartum? It seems my skin has changed and I now get more acne than I did ever before.
Yes, it's really common to have acne postpartum due to the hormonal changes. It probably depends if you're breastfeeding or not, but usually it is a topical retinoid, which we have prescription ones. They're a little bit tricky because they can cause some dryness, so we have to work through with you. And there's a few different retinoids or retinols to choose from. Some are less drying for some patients than others. Washing with benzoyl peroxide wash, which is available over the counter, Neutrogena, things like that. Also a little bit drying, but works really well. Or a glycolic facial wash. And then you want to make sure to use non-comedogenic lotions such as CeraVe or Cetaphil are very good to also make sure your skin is moisturized after all these treatments. There's also other holistic methods that I recommend as well. And I probably do like a lot of the acne medical therapy on the Western side, and then in the cosmetic side, we can use lasers such as V-beam to get rid of that redness for you really quickly. And then you can go on and do your topical medications and we can get it under control for you.
Okay, and what if you are breastfeeding or pregnant?
Okay, if you're breastfeeding or pregnant, you should avoid topical retinoids. So for breastfeeding, it's a little bit more controversial with some lactation consultants saying topical retinoids are fine, but when you're pregnant, you can't use any retinoids or retinol, so you'll have to use azelaic acid or lasers in that case. And benzoyl peroxide has been approved by ACOG as well to use, but of course, if you're pregnant, run this by your OB/GYN.
Okay, great. All right. Here's another question. Can you do all lasers while you're breastfeeding?
So it's technically yes, but we'll have a discussion and all these things because they will not affect your lactation. Sometimes if you do, you might have to pre-treat with a topical anesthetic, which is safe according to like LacMed and lactation consultants while breastfeeding, but still because of, I know like breastfeeding myself, you know, I'm afraid of like supply issues and all these things. So we'll have a discussion about that.
Okay, great. How long should you wait after pregnancy to take care of melasma spots?
Probably, you know, I would give yourself at least 3 months. You know, the first 3 months are a blur and you don't know what's going on. It's like that photo where you're just like holding the baby and your baby carrier and you're just like, please text before you come. So I would probably wait 3 months, and then depending if you're breastfeeding or not, if you're not breastfeeding, we can start a bleaching cream like hydroquinone, or we can do other non-hydroquinone based bleaching creams, which are more plant botanical based, a little bit more holistic. And then we can start the laser therapy right away. But hands down, if you want to start treating it, definitely sunscreen and stay out of the sun. That will help your melasma so much. So that's the one thing you can do now if you're breastfeeding, and then you can always do the lasers as well if you're breastfeeding, but we will have discussions about that.
Okay, great. Let's see, how long postpartum can you use retinoids?
Oh, and if you're not breastfeeding, you can use the retinoids right away. If you are breastfeeding, it is in some societies okay to use topical retinoids per recommendations. So it's a little controversial, but per some articles you can, and some lactation consultants you can, and some you cannot. So that's like the controversy around it, but. The only thing caveat is after pregnancy, your skin is so dry, so you're going to have to use a heavy moisturizer if you're going to use that retinoid as well. And start slow. You want to do maybe like twice a week, then build up to every night. But just your skin is so dry after in the postpartum period that you're going to have to go pretty slow.
Got it. Really helpful. Okay. How long postpartum until you can seek laser treatment for skin tone and brown spots?
Probably, I'd also wait probably like about 3 months. You can go earlier, but it's hard to get out of the house before 3 months. And so in that case, I'd say after 3 months, we can start your clear and brilliant or IPL treatments or radio frequency, depending on your skin type.
Okay, and one more similar but different. How long after pregnancy can you start laser treatments for stretch marks?
That is the one where the earlier the better. So usually if you can come in like at 7, 8 weeks postpartum to treat the stretch marks while they're red, that is the best time. You can even come in like at 6 weeks. It's that we're just using a V-beam laser. We're not using any topical anesthetic. It's a very gentle treatment. So that one, the earlier the better. And it's just the reason I say it's earlier the better is when the stretch marks are red, the laser has something to target and it can shrink those vessels and just decrease that supply source of the scar. And so the earlier, for all scars, the earlier you treat, the better results you'll get.
So is that also true for if you have a C-section?
Yes. For C-section, that scar usually like 8 weeks. You see your OB-GYN like at 8 weeks, and then make sure the scar is okay, and then we can start treating it with a V-beam laser for a C-section.
And the sooner the better to treat it.
And also one thing to start too, if you have an allergy, is a silicone gel like a Stratamed to help also with a C-section scar. I would start that pretty much maybe just after you get the sutures out, just do a little silicone gel there.
That's helpful. Okay, any more questions? Pop them in now. If not, I have one last one left. It's a really good one. How long until I should consider body sculpting or liposuction so I can get my body back?
Right. Oh man, I don't know, but I want to start right away. Yeah, I'm having a lot of trouble losing this weight. It's crazy. But I think you can do, I would say like maybe 4 months, some 4 to 6 months. You can always do like a little bit. If you want to just do like the lower abdomen, just like 2 cups to get started and then see how that goes. A lot of times my patients want to do like a little bit of cool sculpting and they'll see results, and that just motivates them to lose more weight through diet and exercise. So it's kind of this like positive feedback loop, but I would say like 4 to 6 months, give your body a little bit time to rest. And then maybe do like a small area then, and then later if you want, we can do more areas.
And is it true if you're going to have more than one kid that it would be best to get your body back before you have your second child, or should you just wait until after you're done having kids and then deal with it at the end?
I mean, I would probably get my body back after each kid, just because then you're just going to gain more weight after each one. Is like my personal opinion, but I can see the beauty of just kind of like eating how I want until I'm done with kids. That would be pretty fun too. But I'm trying to. I want a second kid eventually, but I'm trying to get back. But, oh, it's hard. It's tough. All I want to do is just like eat scones. Um,
Well, thank you so much. This was really informative. I know there's not a ton of great information out there, especially from a reputable dermatologist, about what to do when you're going through this beautiful time in your life, but that also really affects your skin and body and even your hair and nails. And all of those things are areas of expertise for a dermatologist like Dr. Boen. So thank you so much for coming back a little bit before your maternity leave is over to share your expertise. We're really excited to start seeing you in the office again in a few weeks. And until then, if anyone has more questions, Dr. Boen offers complimentary consultations virtually or in person. So you can go to our website and get yourself on her books before she gets too booked up, because everyone's going to be excited to see her when she gets back to the office. So thank you so much again, Dr. Boen, and I hope everyone has a wonderful evening.
Yes, thank you guys so much for coming out, especially you guys with kids. Thank you for taking time out of your busy schedule to come listen to this postpartum skincare talk.
Bye, everyone.